The Association of American Medical Colleges is pleased to welcome you to today's webinar on optimal strategies for your residency application with a focus on child neurology and neurodevelopmental disabilities. We are recording today, and we will make the archive available afterwards. We will email you when it's posted. We have muted all participant audio. If you need help, please send us a message. This presentation includes time for Q&A. You may submit a question at any time by clicking on the Q&A button at the bottom of your screen. To access the resources, including the slides, please click on the Handouts tab where you logged in today. It is now my pleasure to welcome Richard Peng. Please go ahead.
Awesome. Thank you, Jill, and welcome everybody to the webinar today. As you can see, our focus today will be on child neurology and neurodevelopmental disabilities as a specialty. It's going to be catered primarily towards applicants, advisors, student affairs, and for context, this is an extension of last year's Spotlight webinars. Our audiences found last year that it was helpful to have tailored content for each specialty and a space to hear from both an advisor and a program director. Last year, we had around 5 specialties represented in our pool of webinars, and this year, today's webinar is one of 12 different specialties in this webinar series. For some quick housekeeping here, I'll be doing a quick overview in the beginning to level set, and then we'll hear from each of the different perspectives in the advisors and the respective PDs. Quick shout out here to Dr. Aaron Nelson, Dr. Mia Burnson-Lung, as well as Dr. Mia Asado for representing each of those different perspectives. If you're interested in their profiles, rather than spending, in the interest of time at least, I would encourage you to take a look at their profiles and background information in the registration link to find out more about each of them. One last housekeeping point, many of you and few of us will do our best to address your questions, so feel free to submit them, but thank you for your patience as we crunch through each of them. And so without further ado, let's go ahead and jump into the AAMC overview. The AAMC, who we are, is a nonprofit association. It was created to lead and serve the academic medicine community. The mission, you might know, is to improve the health of people everywhere. And as you can see from this slide, we support over 450,000 members. This is students, program directors, deans, student affairs, DIOs, and we support them in different ways. Maybe it's just the technical services and ERAS, or it's all the way up to representing our members in fighting against NIH funding cuts at Congress. And to add on to that, ERAS is, of course, one part of the larger AAMC ecosystem. We provide a lot of free and helpful resources to empower the community. And these tools and resources were built collaboratively alongside stakeholders from feedback and research. I'm not going to go through every single one here today, but I want to highlight 2. The first one is probably familiar to those of you who are advisors and in student affairs. It's the DWS. As you may know, it's not just an operational piece to support your students and cohort through the residency application season. I wanted to also highlight its data analytics portion, coming from various sources like VSLO rotation data, ERAS application data, thalamus interview data. It provides quite a bit of live reporting for your cohort of students. And with that, it's going to help you with future seasons as well for your planning and strategies. The other plug I wanted to make here was the Residency Explorer tool. Lots of work that's gone into this in the past 2 years. It's co-sponsored by multiple national organizations involved in the transition to residency. And the tool empowers students to find programs aligned with their needs and interests, but also assess their competitiveness and to form their list of programs that they want to apply to. And last year, we found that 71% of applicants actually use this tool in completing their MyERAS application. They used it to compare programs based on their characteristics, educational offerings, benefits, and even residency characteristics. And what really makes this tool special is the fact that the data comes from source-verified products like the GME Track National Census, data from the ERAS application, Thalamus, as well as other partners like the NRMP, NBME, and the NBOME. We've hosted a couple webinars already in May. If you haven't seen them, go to our handouts, go to the webinar section. I highly recommend those videos to see training, but also updates. And speaking of updates, our selection sciences team, or the R&D team at the AAMC, has been innovating on this heavily in the past 2 years. Again, this is based on research and community feedback. The first change I want to highlight is increased specialty coverage. We're going from 25 specialties to 40 plus specialties, so much broader access here. The other piece is, of course, enhanced program-specific details. This is going to be around program requirements, things that really help you in the application process. Thirdly, we're at the tool is going to be incorporating more license exam data, both from the NBME and the NBOME. This is your USMLE and Complex USA scores and data. And then last but not least, it's going to include more expanded residency match number offered and filled positions by position type. You can see in the bold there the particular new additions. Moving on to the ERAS application changes here. Two I wanted to highlight. For those of you in the audience who are IMGs, we buffed the postgraduate education so that you include non-accredited ACGME trainings. This will allow you to input that information so that programs can more standardly and more efficiently find that information. And the other piece I want to touch on is just an update to the extensions and interruptions question. This has been a multi-year process to improve this question and improve its clarity. Definitely can keep improving on this, but wanted to highlight this. And if time permits, I know we do have a registration question around how to approach academic challenges, and so that might be a place our panelists can touch on that perspective. And last but not least, I have just a few QR codes. These are also in the handouts, but if you have the slides, this is a great way to get that information. And so with that, I'm going to go ahead and turn our attention to each of the respective perspectives. We'll go ahead and start with the student advisor perspective for Dr. Aaron Nelson. Again, you can take a look at his more extensive background that really will show the experience and credibility to each of the panelists' perspectives today in the registration page. But again, without further ado, I'll go ahead and turn it over to you, Dr. Nelson.
Great. Thank you so much. So a lot of you are here because you're either applying to child neurology or you're going to advise someone who's applying to child neurology. And so the first thing to really understand is what it is as a field. And so when you apply to child neurology, there's a few different tracks that you can take. One is a categorical 5-year training program. And so you apply directly from medical school, and it will encompass 2 years of general pediatrics, and then 3 or 4 years in the case of neurodevelopmental disabilities of neurology-specific training. There are alternative pathways, including a reserved position that just includes the final 3 or 4 years of neurology training, but that requires a prerequisite of pediatric training. There are also advanced positions, but those are really only for people who are interested in training at multiple different sites over the course of their residency training. Child neurologists have the opportunity to maintain longitudinal relationships. You can work in an ICU setting. You can do procedures. You can do all sorts of different things that allow you to form meaningful bonds, both inpatient and outpatient. And so there's a lot of options to think about when you're considering going into child neurology or advising someone going into child neurology in terms of the options. Next slide. So as you're starting out, the first place to start is to just update and think of all of the things you've done. And so that's updating your CV. That's something you can do on your own, but you really want to have someone else look at it, someone help organize it, make sure you're including the things that you want to include, and think about what things might drop off in an application to residency at this point that you previously included when you were applying to undergraduate or graduate medical education. And then you really want to reflect and think about, where have you come from? What was it that led you to go into medicine? But then what is it that has you wanting to go into child neurology right now? And then if you really want to feel the competitive application, you really want to think about the future and think about what are you going to do in child neurology and what is it that you're going to bring to that field. And as you organize those thoughts, you can do that with your CV. You can think of your strengths and weaknesses and build that into your narrative that you do with your personal statement. Next slide. And so a good place to start is to download the ERAS applicant worksheet. If you're a student applying, it's a good way to organize things. If you're an advisor, it's something to give to your advisee as a way of sort of approaching this in a logical and in an organized fashion. You want to think about what your past experiences are because now there's standardized ways of putting that in. And you're going to need to think about, at least on paper or for an interview, which of those things are most meaningful to you and which are the things that you would ideally like to end up talking about if you're interviewing a bunch of different people and they have to pick from a small list of the things that you've talked about doing. Next slide. And so once you've thought about, why you're going into child neurology, you've made the brilliant decision to go into child neurology or neurodevelopmental disabilities, and you've got that initial application together, then you need to think about how to develop your program list. And for that, you want to think about really what's important to you, because in the best case scenario, you're talking about devoting the better part of a decade to training for this, sometimes potentially longer. And different things are important to different folks at different times in their careers and different times in their lives. And so you want to think about the factors that are important to you. Think about how to target your application to appeal to the programs that appeal to you. And then really know that you've got a comprehensive list of those programs. And a great place to start is with Residency Explorer. You can use the FRIDA system through the AMA or the Texas STAR system, but also you want to talk to your advisor or your institution, the experts that are there, because they will really know a lot of the programs and can help point you in the right direction. Next slide. And so as you're then doing that, you have your initial list. You can then go to those individual schools or programs, look at their websites, figure out what their core values are, what their goals are, how they align with you. You can get a sense of what areas they are particularly strong in, what areas that perhaps you might want to go somewhere else for training for, and then talk to the folks at your own institution or other institutions who've already gone through this process. They'll have a good sense of what the training programs are like, what the pros and cons are, either during the time they trained or now, or a little bit of both. Once you've done that, then you want to draft a tentative list that you might consider applying to. And then you have to think about how many places you're going to apply to and in what order you might place them, because you're going to need to think about signals, which we'll talk more about in the next slide. And as you're doing that, you really want to talk to multiple people. You want to talk to individuals who have gone into the area. Ideally, if you have other people that you know who are going through that process or applying, you can get a sense both from your medical school advisor and from those in child neurology how competitive an applicant you are, because that may dictate how you want to use your signals. Next slide. So the signals, they're the source of a lot of anxiety. It's actually a really good thing. There are 3 signals that you can use to apply to child neurology and neurodevelopmental disabilities. They are shared across them. So you have 3 signals, whether you're applying to one, the other, or both. And those 3 programs are the places that you're saying, based on your initial review, your knowledge at the time, that you're most interested in. It's not a binding commitment. It doesn't mean that you have to, ultimately rank them in your top, but it's a way of indicating that you're very interested in their program, which is really important in today's age of modern virtual interviews, where people can be applying from all over, and it can be harder to distinguish yourself. And signals are a really good way of doing that. The official AAMC guidance is that applicants should signal their most interested programs, period. You're most interested in these 3 programs, you signal them, whether they're your home institution, away institutions, whether or not you've done a visiting electives. If you have a different perspective from your individual institution, it's always important to get that from them, but that is the baseline recommendation. Next slide. As you're thinking about programs, how many to apply to, which ones to apply to, you want to think about what type it is. Is it categorical, 5 years, or 6 years in case of neurodevelopmental disabilities? Or are you going to be cobbling together a combination of pediatric training followed by a reserved or an advanced program? You want to think about how established the program is, that it's accredited in good standing. And then you really want to think about the factors that matter to you. For a lot of people, that's where they want to live in the country, being near friends and family. But for other people, it might be a very specific disease pathophysiology that they want to see, or a specific expertise or resources, whether that be from a research perspective, a clinical perspective, or something else entirely. And so those are the things that you'll gain from reviewing the website, but also talking to individuals at your institution and elsewhere, and people who have already gone through that process before you. Next slide. So then ultimately, how do you decide where to apply? You can think about what's most important to you, but then you can look at what people have done that have come before you. And the most recent survey from 2024 and 2025 from ERAS, the number one thing was the alignment of a program with the individual applicant's strengths and career interests. So they really wanted to go places that would allow them to do what they wanted to do, because there's so many different areas within child neurology to subspecialize in, and different programs have different strengths and areas in which they excel. The next most likely reason was geographic location. And in addition to signaling up to 3 institutions, you can indicate geographic signals. And so that's another way of geographic preferences. That's another way of signaling a particular place that you're really interested in being in. And then quality of life, lifestyle are really important, being near friends and family, but also how competitive are you? You may or may not want to use all of your signals on the absolute best institutions in the country. You may want to think about, what are sort of the top programs, what are the places that you'd be very happy at, and what are places that you really think that you're competitive for, should you not get that first or second choice. And so that's when people think about their perceived chance of matching or their perceived chance of an interview offer, because signals can factor into that. Next slide. So if you've applied and you've signaled and you've been offered an interview, which is exciting, right? That's all of the successful steps you want to get to, just a few short months from now, then you really want to know what your application says. You don't want to show up to an interview and not have a handle of the narrative of how you are presenting yourself as an applicant and really how you're trying to appeal to programs. And so you want to know that, be prepared to answer questions if you have things on your CV, be very prepared to talk about anything in your impactful experiences or in your personal statement. And you really want to ideally think of how would you portray your strength as a candidacy, but also why they should want you, and practice comes into that a lot. You can practice virtual interview formats, you can practice with institutions, with individuals at your institution, and you'll get better doing it over time. Next slide. If you're an advisor, you have the advantage that you don't have to go through that process, but you need to guide people through that process. And so again, the ERAS applicant worksheet is a great place to start and organize your thought, along with the online databases like Texas Star, Residency Explorer. But really, if you have a collective knowledge amongst the advisors at your institution, the faculty at your institution, or former trainees, then it's really good to build that network and that set of knowledge. And that's how you would go through things. The main thing you want to make sure is that your applicant is, and your mentee is going through all of the things in the proper timing and getting through things as they need to do. Next slide. This is just a list of some helpful resources from the Child Neurology Society, both for general child neurology and neurodevelopmental disabilities, also the NRMP Match Residency Data and Program Director Survey, which give more insight into what people are looking for in applications and candidates. Thank you.
Awesome. Thank you, Dr. Nelson. We'll go ahead and turn it over to the PD perspective for today's webinar. Yeah.
Great, thank you. Hi, everybody. I'm Mia Brinson-Lung. I'm so excited to be here to talk about child neurology and NDD, which are obviously the best specialties in all of medicine. I am the director of a child neurology training program and also a specialty advisor at our medical school. So I'm going to echo a lot of the things that Erin said. And next slide. Briefly showing some match data. This isn't to get really bogged down in the numbers, but to overall say child neurology is a relatively small field. There's about 200 positions per year. There are also a relatively small number of applicants. You can see over time it's fluctuated, but in the 400, 500 neighborhood. And keep in mind, a lot of those people may be applying to more than one program, and we'll talk more about that in the Q&A. So maybe applying to peds or NDD or psychiatry, things like that. So I really want to send a reassuring message that if you want to become a child neurologist, most likely you will be able to. So hopefully that takes a little stress off. Next slide. But how can you really sort of make your application stand out? What do I look for as a program director when I'm reading these? I think that the takeaway is there's no one profile of a successful child neurology applicant. We really do look holistically and individually at our applicants, and there's certainly things that we consider, but no one of these things that makes or breaks your application. I think we really want to see excellent clinicians in pediatrics and in neurology, and so those particular rotation grades plus your clinical comments, and then if you've been able to do a child neurology rotation, or maybe some people had child neurology experiences as part of your peds or your neuro clerkships, to really make sure that those are where you're excelling. I would say Richard and others provided really great information about how to compare your competitiveness as an applicant against some available metrics. But I will say, take that with a grain of salt in terms of board scores, because many of us don't have any particular cutoff or minimum that we'll use when we're looking at an application in terms of those board scores. I will say that failing a step is something that we look at pretty seriously, but that's something, if that applies to you, to really address proactively in your personal statement or elsewhere in your application. Research experience, we'll talk about, can we go back for a second, please? We'll talk about a little bit more. It's not something that is by any means a requirement, although many child neurology applicants do have research experience. We have a lot of MD PhD applicants, and I think whether it's research or some other scholarly work, education work, quality and improvement work, advocacy, really focusing on quality over quantity. So not just checking that box with a brief experience, but really over time, investing time in it, whatever your passion is. One question that comes up a lot is, well, maybe I only had the opportunity in college or in med school to do Parkinson's disease research. Is that going to negatively impact my child neurology application? And I would say absolutely not. We see that a lot. And so that's, again, your opportunity to tell that story in your personal statement, and or encourage your research mentor, who's hopefully writing you a letter of recommendation, to think about how might that apply to your future work as a child neurologist. Publications, not a requirement, certainly great when we see them. And I would say in general, those are more impactful than abstracts. So if you have a chance to take something all the way to a publication, definitely do that. We know that can take a long period of time. So if something is in the works, you have a manuscript that's being prepared that you hope to submit, definitely mention that in that experience section. And then if you're able to present at national meetings, for instance, which we'll talk about in a sec, that's certainly more impactful than local presentations at, a medical school research day or something like that. Extracurriculars, we love seeing people, again, who really have depth of involvement, maybe including leadership roles or some sort of long-term, many-hour commitment over time. And that can be in formal school or other programs, or a lot of people come into child neurology because of an experience, either personally or with a family member with a neurologic disorder, and maybe that's been your sustained exposure to the field. So I think really bringing that out and reflecting on those experiences in your personal statement, we see that a lot, and that tells us a lot about you and your understanding of the field if you have a longitudinal experience working with people with neurologic conditions. Next slide. So some things to expect about the interview day. A lot of these Erin already mentioned, do your research about the program. We love to hear people who already have some idea of an aspect of the program that might appeal to them, or particular people that they're interested in reaching out to or have already reached out to. And there's so much out there. We've really all across the board as programs tried to boost our online presence. So take a look at those online, websites or brochures. And then there's lots of opportunities like virtual open houses and happy hours to come and hang out with us virtually prior to your interview day. You can find a lot of programs on X and Instagram, and then also there are accounts like @NMatch 2026 that every year gets updated with the year that collate some of these different resources all together. Your interview structure can vary a lot from program to program, so just make sure you're carefully reading that invitation and thinking about, is it going to be just a child neurology day, or is there also a separate pediatrics day? Again, that'll vary from place to place. In terms of sort of when to expect interviews, advocating for interviews, we as a field have for the second time this coming year committed to, excuse me, a universal interview release date. So what that means is you don't necessarily get all your interview invites on that day, but in theory, you shouldn't be receiving them before that day. And I believe it's going to be October 10th this year. So a few weeks after ERAS opens. So give us a little time to do that holistic review. And then just try and get a sense, if you haven't heard on that day from a place you really love, maybe give a little bit more time, or you can certainly reach out and just express your enthusiasm for that particular program and inquire, when you might hear back. Certainly if there's anything that's a big update in your application, you just had a paper published, or you just were promoted to a leadership position, that's a great opportunity to just mention to us. Next slide. This slide's really about post-interview communication. So some of these things are universal. So we cannot ask you about your rank list. We cannot ask you to rank us #1 and then say that we'll rank you #1, accordingly. We can't do that quid pro quo. We may tell you that you are ranked to match or ranked highly, or that we really loved you, or whatever it might be, but we don't expect and cannot expect any kind of particular response to that. And then you are certainly welcome to tell us if we are ranking, if you're ranking us first or highly or whatever it might be, but you don't have to. And there may be some programs that tell you across the board, we don't want to hear from you after the interview, nothing personal. We just want to keep everything, really clear. So that does vary program to program. I think for that post-interview communication phase, again, it's lovely to have a follow-up that, expresses gratitude for the interview, but especially I loved meeting, so-and-so, and I would love to meet with them further if I could learn more about their research, or if you can connect me with someone who's doing work in this particular area, or if there's any of those updates about, no, really, I would love to come to Boston, even though I've only ever lived on the West Coast because my sister just, moved there and had a baby, and I'd love to be there. Just let us know things like that may, help us understand your application. And I think hopefully this last part should go without saying, honesty is always the best policy. We're a really small field. We all talk together and work together. So definitely only send that I'm ranking you as my top choice program to one place, and any other, similar communications. And next slide. I think we already covered all of these points about program signaling. Again, neither of them is a make or break as far as whether or not you get an interview. It's just one piece of the puzzle. And we'll go to the next slide, which I think is my last one. So quick plug for joining professional associations. If you are not already a medical student member of the Child Neurology Society, please come and join us. There's lots of educational resources. You can come to the annual meeting and maybe present a poster. There's always student programming. There are even student awards and research programs. And then we do have a footprint as well in American Academy of Neurology and the American Academy of Pediatrics, although more so in AAN than AAP, and definitely encourage students to get involved in all of those. It's a great way to, again, it's a small field, get to know the people, get to know the programs, get to know what's going on, and start to take this next step in your career. Thanks very much.
Awesome. Thank you so much. Let's go ahead and keep things rolling. I'll go ahead and turn it over to Dr. Miyasato to provide the PD perspective for neurodevelopmental disabilities.
Good afternoon, everyone. Next slide, please. So I'll tell you a little bit about neurodevelopmental disabilities, and I would say one way to think about this specialty, because it's perhaps something you haven't heard very much about, it is Child Neurology Plus. It is a neurological subspecialty that is both a residency and a fellowship pathway, and I'll say a few more things about that in just some upcoming slides. It is similar to child neurology, but it is a distinct training pathway. And I would say, while it is very focused on children with neurologic disorders, there is a greater emphasis on the assessment of developmental disorders. And when I say developmental disorders, I'm thinking about things like autism, cerebral palsy, genetic disorders, ADHD, intellectual disability, and really thinking about it in terms of a lifetime or a lifespan perspective, because these disorders are not typically outgrown during childhood. This is a 6-year total training pathway as a residency, and you are board eligible in child neurology and neurodevelopmental disabilities. And you are also eligible for any training, like fellowship training pathways that would be accessible for child neurology graduates. So if you wanted to do fellowship after NDD, you certainly could. Next slide, please. So as a neurologic subspecialty, I think it's interesting to think about all these different specialties and consider where they originated from. So when you think about child neurology, it really evolved from adult neurology. So while many child neurologists are working in children's hospitals, their training was very much based in both adult and pediatric neurology. So we're not very similar to the traditional pediatric fellowships. It's kind of this unique training pathway. And there's a focus in traditional adult neurology training on lesion localization and thinking about neural systems. So this has really been influential in the development of child neurology training. There's a specialty within pediatrics called developmental behavioral pediatrics, and that is truly a pediatrics fellowship pathway. And in that specialty, they may treat some of the similar kinds of patients, but really they're thinking of the family as the target organ instead of the CNS. Physical medicine and rehabilitation may also treat patients with disabilities, but they are not as often involved with the initial diagnostic process, and they may be more focused on multidisciplinary care, therapies, and the focus is on improving function. So neurodevelopmental disabilities is about 20 years old in terms of it being a specialty, and it was originally co-sponsored by both the American Board of Pediatrics and the American Board of Psychiatry and Neurology. But now it is strictly a neurological specialty. You are able to take your pediatrics boards, but it is no longer required. And our target organ is the developing CNS. The focus is on evaluation, comprehensive management, thinking about the prognosis and the development beyond the primary pathological process. And typically we follow our patients for long periods of time because development is this very dynamic thing that happens in childhood, and what a child may look like at age 6 may be very different when they are an adolescent. We also focus on lifespan care. There are some NDD doctors who are taking care of adult patients, and there's also a focus on advocacy and disability law. Next slide. So the pathway to NDD, as I mentioned before, it is both a residency and a fellowship for people interested in residency training. There are 2 years of pediatrics, and it could be at the same institution or at a different institution. So that's both the categorical or the C position or the advanced position, followed by 4 years of neurodevelopmental disabilities. There are 8 programs now that offer this kind of traditional 6-year pathway, including Children's National in DC, UPMC in Pittsburgh, Kennedy Krieger, Indiana, Oregon, UT Southwest in Houston, and Texas Children's Hospital at Baylor. You can also, there's another kind of position that I didn't mention called a reserved. And that type of position is for people who have completed their pediatrics training and are ready to start the NDD portion of their training. The other 2 positions are really 2 years in advance. So it's a little complicated, but I'll tell you how to work around that. So for fellowship, there is now a 1-year NDD training pathway for child neurology graduates because the training pathways are somewhat similar. And so we were able to create this 1-year pathway for people who have finished child neurology. This is outside the match. And the programs that have this 1-year pathway are Kennedy Krieger, UC San Diego, UT Southwest, UCLA, and Children's LA. And if you are a pediatric resident, as a pediatric resident, child neurology resident, you can consider a rotation at a program during your residency if you're interested in that. Next slide. So recommendations for medical students. So I would recommend doing a 4th-year elective in NDD if possible. If that is not possible, I strongly urge you to consider a child neurology elective as a 4th-year student because you will see a lot of the same patients, and there could be people in that child neurology program or department that see patients who have more neurodevelopmental disorders. If you have always been interested in patients with disabilities, you should assess your interest in NDD and think about whether it's a good option for you. Because there are only 8 programs, many people are co-applying to child neurology. I strongly recommend that you reach out to each and every program director of a program you might be interested in, and you can get the contact info on a website called nddtraining.org. This is an all-program website, and all of the program director information, contact information is there, because of the complexities of the different positions. As I said before, many people are co-applying not just to child neurology, but also categorical pediatrics. And so if you are unsure about what type of position you should be applying to, please reach out to the program directors before you actually spend the money. We will be having an open house in August, on August 5th, which will be announced through the CNS and the AAN Child Neurology and Adults with IDD sections, and also through the American Academy of Developmental Medicine and Dentistry. Next slide. Consideration for applicants: you can use your child neurology statement and letter of recommendations. You don't have to create a whole new essay. Not all the programs are using signaling, so check. Share your connection with childhood disability or NDDs in personal statement or interviews. Some of the programs offer a year of research, so if you're interested in research, it may be important to think about that and who you might want to meet before your interview. And please ask questions about the different types of positions for NDD before you start applying. Next slide. And here are some of the resources. Thank you.
Awesome, thank you so much. At this point, we'll go ahead and transition into the discussion and Q&A portion of it. Some of these questions that came up were actually from our pre-registration, and we'll go ahead and try to infuse some of the live questions that are coming too, because I feel like there's some overlap in those questions. The first one is a fairly straightforward one. This has to do with what you might see in other specialties in terms of required documents. Are standard letters of evaluation, or SLOEs, or any equivalent to that, is that a required document for either child neurology or NED if you're applying to those respective programs? And I'll go ahead and turn it over to the Mias if possible.
This MIA says it is not required at our program, and I don't know off the top of my head of any child neurology programs that would require it.
Ditto with NDD.
Okay, awesome. So no national rule to that. The next question that we have is about, again, the child neurology residency program. If your institution does not have a child neuro residency program but has child neuro faculty, do you need to complete an away rotation prior to applying? Would a child neuro elective as well as an adult neurology suffice? So I know we have a few questions in here that echoed this. I'll go ahead again, turn this over to the Mias, if that's okay.
Yeah, I can start with this one. I think what I look for in an application is that you've had some sort of substantial exposure to the field that includes some hands-on work, not just, sort of shadowing a child neurologist over time. But if you've been going to clinic with a child neurologist for, months and have really gotten a chance to get a good understanding of the field and what it's like, then I think we definitely do see people every year who apply without a formal child neurology sub-I. Certainly an away rotation can help you with really demonstrating your skills and potentially getting a letter from a child neurologist, but I don't think that it's a requirement. But curious what Mia and Erin would say.
I echo a lot of those insights, and I would say that an NDD letter is absolutely not necessary, but I would be very I think it's a very strong format to have a child neurology letter of recommendation. I think it adds just to me being able to envision this candidate as a future neurologic specialist.
Yeah, I think everyone gets the context that people come from different institutions and have different opportunities. And so we're a small enough field that a lot of us know that innately, but if you feel the need, you can always explain that. And I don't think anything like that arbitrarily available at one institution or not would be disqualifying.
Awesome, thank you. Let's go and transition to the next question. I know that this question goes, what types of experiences should I use for my selected experiences and meaningful experiences? I know you each kind of covered that in your presentations portion, so I'll kind of focus on the last bit there. What do I put in the hobby section? Is there any sort of perspective there that you'd like to share? And I'll go ahead and start with Dr. Nelson, please.
I have strong feelings about this that are not always shared. Just bear in mind, this is still a professional interview. So don't put something in your hobby section that you don't want to be talking about with a future educator or boss. And that's basically what I'd say. If you want it to round out you as a person, I think that's excellent. If it humanizes you, that's great. But just sort of bear in mind still the context.
Dr. Osato, do you have a perspective from the NDD front?
Nothing else to add. Thank you.
This next question, we had a few questions in the live Q&A right now already around this. With regards to parallel plans or just applying to multiple specialties, is there any sort of guidance here? Should I be considering applying to adult neurology and or pediatric programs as well? I'll start with Dr. Nelson first, but then I know Dr. Asado, you kind of touched a little bit on differences between pediatrics and NDD, so if you can go with that route.
So there's a lot of different reasons people do this, right? So people can do this because they're concerned about being competitive. They really want to be at a specific institution or a region, or maybe they're interested in neurodevelopmental disabilities, but as it was talked about, there's, the number of programs that there are, and they still want to apply to more programs. Some people want to work with specific diseases that are appropriate to think about in both the child neurology and adult neurology spaces. I think the best thing you can do is transparently communicate this. Just know that programs talk and the program directors within an institution talk. So if you apply to multiple programs at an institution, they will know about it. And that's not necessarily a bad thing, but then I would be transparent about it.
Dr. Asado?
I would just also add that make sure your letters of recommendation are talking about the specialty that you're actually applying to, and that your essay is also congruent with that specialty. I've seen some candidates who clearly are using a more generic type of essay or they haven't changed the specialty name, and that would be concerning. I also suggest that you have an appreciation for the perspective of the pediatric program director who may be concerned that a candidate may want to try to leave after 2 years instead of finishing a whole 3 years of pediatrics. And so as Erin said, it may be helpful to be frank and say, I am committed to completing a 3-year pathway because it's important to me to be a full-fledged pediatrician. But I have had a lot of feedback from pediatric program directors who, when they see a candidate is very focused on child neurology, they may have reservations about trying to match them because they're afraid they're going to lose their senior residents.
Anything to add, Dr. Brazil?
I think the only thing I would add is, as Dr. Asado already mentioned, many people apply to both child neurology and NDD at the same institution, and we often have very overlapping, recruitment and selection processes. So if both of those truly fit your interests, by all means, go for it.
Thank you. So this is for the subset of IMG applicants who are in the audience today. What if we have no child neurology electives and they're difficult to obtain? Any sort of guidance on this front? And I'll direct this to Dr. Nelson again first.
So the main thing to do is just to understand the reality and that you're trying to explain why and how a program director should want to take you seriously as a candidate for their program. And so we get that you may not have been able to do any neurology or child neurology electives, and you may have had limited experience or exposure to things. And I think you can be transparent about that. The things that can be still helpful are evidence that you've worked within similar medical systems, so that you have comfort and understanding of those aspects of things. Other things that can be very useful are aspects of your CV or your statement that really explain your journey and your narrative and how you are clearly still interested in neurology or child neurology or neurodevelopmental disabilities and have done things in that realm, even if you didn't have access directly to the electives. Those are the ways that you would still distinguish yourself.
Awesome.
And I would just add that having pediatric experience in the United States is also, I think, very strategic because it really helps with particularly these combined or advanced positions where the pediatrics programs are looking for well-trained medical students.
Thank you. Thank you. This next question has to do with academic challenges. If an applicant has had them, what sort of guidance might you provide in terms of highlighting them in a positive way or more constructively, and then helping in a constructive way where it might help them with interviews in that process. Do you mind if I start with Dr. Burson Lung for this one, for the child nurse perspective, and then we'll go to Dr. Asado for the NDD perspective?
Sure, thank you. So I think that if people had an academic challenge, had to remediate something, failed a step, whatever it was, I think what always sticks out to me as someone reading the applications is if people really come at that proactively and from a place of sort of strength and positivity and a growth mindset. So if you say, I really struggled in this class, and then I realized that I was having a lot of trouble with standardized test taking, so I went to my Office of Student Services, and now I have all of these strategies that I will use forever, that really shows your growth and your dedication. So I think just being open about that rather than sort of hoping that somebody won't notice or something like that. It's also something that your medical school advisors can talk about within the context of the MSPE and sort of put it into context there. And then the last thing I would say is we as a field care for a lot of people with neurodiversity. We have a lot of people who are providers in the field who have neurodiversity. And so if you found out during medical school that you have ADHD, or you had, some other condition that was impacting on your academic experience, I always encourage people to be very open and transparent about that. That shows us that you know what it's like to be a patient with a neurologic condition, and that's only going to make you stronger as a clinician. And people are sometimes, this is a whole nother, story, but people are sometimes worried about, disclosure and how that's going to impact on them. You might not want to go to a program that wasn't going to be embracing of you and who you are and how your brain works. So I think that there are ways that you can frame this very positively as a challenge that you have overcome.
Dr. Asado?
I have nothing to add. I think that was answered beautifully. Thank you.
One thing I do want to kind of call back to in terms of the application changes for the interrupts and extensions. One of those questions is more focused on the academic challenges, for example. One thing that has already mentioned, definitely work with your advisors to make sure that the MSPE and that question are kind of in sync in terms of that response. The question in the application is an opportunity for you as an applicant to share your experience there. It's a little bit more focused on the coursework, but the MSPE is a place where you can have a more comprehensive piece on any sort of other academic challenges, including board exam remediation. Next question here has to do with the geographic information. This has been alluded to prior in the presentations. How might you use all the geographic information, maybe other types of geographic information, not necessarily the geographic preferences, in terms of the address, medical school location, especially when you review applications? And I'll direct this towards you, Dr. Princeton.
So I think sort of the theme of the day, it's all just a piece of the puzzle. I do think that we look at where people have some kind of a geographic footprint. But again, if there's some reason that you're particularly interested in either a program or a region, or ideally both, that's not immediately apparent from your application, that's a great chance to either write a customized personal statement, which I think is one of the other questions we'll be discussing, or just sending an email or communicating. You have that opportunity within geographic preferences to sort of say, again, yes, I really would love to move from the West Coast to the East Coast, or the East Coast to the Midwest, or whatever it is. And here's why, or I'm open and want to move and I have wanderlust and I'm open to wherever will give me the best, best education and training. So I think it's just a piece of things.
Awesome, thank you. Any other inputs to this particular question? I was getting off mute there. I do see one live question about including mental health conditions. I know, Dr. Guzman, you're responding to that in chat. I just wanted to add, for that particular question that I was referring to in the ERAS applications for interruption extensions, you'll see a note there. Just pay attention to that note that says that you should not be including any sort of mental health conditions there. You can save that for other parts in the application. But with that, I'll go ahead and move on to the next question. How important is research when applying for child neurology or NDD? How should we discuss our research experiences in our application? I know we touched on this a little bit earlier, so I'll start with Dr. Asano first, and then go back to Dr. Princeton.
As I mentioned earlier, some of the NDD programs offer prolonged periods of time protected time to do research. And so we really are interested in whether someone is interested in doing clinical, translational, basic research or quality improvement. And we are looking for people who have a vision for that, and who have questions about academic resources. It's not necessarily important that everyone has advanced degrees reflecting research experience, but I think an interest in research for NDD is important because we are interested in training the next academic generation. And we hope that people will be able to talk about their research experiences during interviews. So that's something you should definitely be prepared to do.
Yeah, I don't think I have much to add. Do be prepared to discuss your research. It may be that, you wrote the paper several years ago and you've been doing something else since, but make sure that you're refreshed on it because you may get those questions.
Awesome.
That's more in the interview than in the application.
Perfect. So this next question is around the exams. I think you alluded to this earlier in terms of the importance of the pass-fail. How important is that, and how has it affected what's needed to be considered competitive? I'll actually pair this if it's okay. There was a kind of commonly asked question in the Q&A for applicants in terms of having both the USMLE and the Complex USA exam. And if it's possible to kind of tackle both of those questions. I'll start with you, Dr. Burnson-Lung, and then we can move on from there.
Yeah, I don't think a whole lot to add to sort of what I previously said. It was not something that our field was really putting a ton of stock in even before when we had step one scores rather than pass fail. I think we do really look at, well-rounded applicants who have achievements outside of the test taking arena. I'm not sure what my colleagues would say in addition to that.
I would say that the fourth year rotations, if there are grades being given for fourth year rotations, can be very helpful to see if people have done well on their acting internships, whether they've done well in their electives. And in addition, thinking about the quality of your letters of recommendation, I think have become more important to me as an evaluator looking at applications. I'm looking for strong letters that really speak to multiple elements of the candidate.
Awesome, thank you so much. We'll go ahead and move on to the next question then. This is a more general question. I'll kind of do a rotation for each of the PDs. Are there common pitfalls you might see in child neurology applications that you wish applicants avoided? We can start with Dr. Asado, since you started off earlier, and then followed by the other perspective, if that's all right.
Sure. I really enjoy talking to candidates about cases. And so when I meet an applicant who is really not able to tell me about some of the cases they've seen, it's a little disappointing. So it's something that I urge you to kind of be prepared for. And again, make sure in your application that your essay, your letters all match up to the same specialty if you're applying to multiple programs.
Yeah, I can jump in. Completely agree with both of those points. And I think, in terms of the personal statements, I sometimes see people sort of write, kids are amazing and brains are amazing, therefore child neurology is amazing, which is 100% true, but isn't the most sort of distinctive way to really express like your deep understanding of the field and what our interactions with children are like, what our interactions with families are like, and what you might bring to the field and what you might do within the field. So I often tell people, if you think that you might be interested in doing an epilepsy fellowship because you had this amazing experience that you're writing about with with a family with a new epilepsy diagnosis, write that, give us some sense of, I can see myself wanting to do clinical research in this area, or I can see myself wanting to do this. You're not committing yourself. Don't worry, we're not going to, set it in stone, but it shows that you've really engaged with the field and thought about what careers are like. And, that's where you can be really talking with mentors, either at your own institution or that you've met through things like Child Neurology Society, to get a sense of what the possibilities are. And so I think those personal statements are the ones that really jump out to me. Is it's not only do I love working with kids and do I love thinking about the brain, but here are the personal qualities that I bring and my life experiences that I bring, and I can see myself going in this direction. I think that just really shows sort of a mature level of thought in a candidate. So that's a big one for me.
Awesome. Thank you. Thank you. Now, there's a live question in the queue we'd like to address. It goes, are there situations in which a candidate is accepted to a program for the 2 years of pediatrics training, but not the neurology portion, or vice versa? Should we be tailoring our applications differently to increase the likelihood we have for both portions of training at the same institution? Between Dr. Brinson-Lung and Dr. Nelson, if you could tackle that question.
I'll start off because this is a thing people are commonly confused about, because it is confusing. So if you are graduating medical school and have done no residency, there's a few different pathways you can do. The single stop pathway is to apply to what's called a categorical program. If you apply to a categorical program where its listing should start with a C, then you end up matching for all 5 years. And so it's one NRMP match, and then it's all 5 years, the 2 years of pediatric training intermixed with then the 3 years of neurology training. There are also the opportunity to apply to the reserved and advanced pathways. The reserved and advanced pathways are similar in that they only include the neurology training. 3 years for child neurology, 4 years for the neurodevelopmental disabilities program. But to be eligible for those, to actually start doing them, you have to have completed pediatric residency training requirements before that. Occasionally, people will want to do things at 2 different places, or as Dr. Asada was saying, they may want to do a full categorical pediatric residency first for 3 years and then do an advanced or a reserve position, and you can do that. You can't apply to a categorical program and have them say, well, we'll take you for the pediatrics, but not the neurology. It's a package deal. You can choose that you want to separate them or break them down into separate areas. And for pediatric programs, if they have a categorical program and it fills, that takes their pediatric spot. But if they fail to fill their categorical program, occasionally they will reflex that spot back to their pediatric program so they can fill it however they'll fill. And I'll turn it over to someone else because my explanation may not have been clear, so someone else can explain better than me.
No, I would have said the same thing. I think that Ashley is going to assist by posting in the chat the list on the Child Neurology Society of the different programs that are available to match, and that breaks it out by how many categorical slots, advanced slots, and reserve slots are available at each of those programs. And it can be confusing because some of them, for instance, our program has both a categorical and what's called a joint advanced prelim, that kind of 2 and 3 year package deal that ours is focused on sort of like clinicians and clinical advocates who train in a different pediatrics program and then come and have the same child neurology experience with us. So it's very confusing. If you're ever lost and wondering, where do I send my application to, just reach out to us. We answer this question a lot. But no, you wouldn't be left sort of high and dry without having the neurology piece. You just wouldn't match to that program at all, if that makes sense.
Before you spend the money on applying to all these different types of positions, it's worth talking to your advisory dean or reaching out to a program director for insight, because I definitely might provide different types of information based on your training background.
Yeah,
Awesome.
I think that's a great point. And just to grab the mic back, I'm sorry for a second. For this often comes up as a question, and you sort of said it, Erin. For IMGs, unfortunately, that pediatrics training needs to be done in a program either in the US, in Canada, or there's a very small number of ACGME international accredited specialty programs, I think is the official term. So I often see IMGs applying to the reserve slots because they already have done their pediatrics training, but if it was done internationally, unfortunately, that doesn't qualify you. You do have to start over and do the 2 years of pediatrics in the United States. Not our rule. We didn't make the rule. It's just, it is what it is. So
Small plug there. What I was mentioning earlier, the change to the postgraduate training information, ACGME specialty accredited programs is one of the drop-down options that was added this year. I know we're down to the last minute here, so I'll squeeze in one live question and then we'll wrap things up. With away rotations, what are some key areas that we should focus on in terms of excelling and doing our best? How can I best prepare in advance for those away rotations? Mia's?
Well, I'll just say, particularly if you're a fourth year student, I'm really looking for intern level of participation. So I'm looking for whether someone can synthesize cases efficiently and in a comprehensive way, whether they bring a lot of enthusiasm to the different types of cases they're seeing in clinic or on the hospital floor. And I'm looking for whether they are interested in advancing their knowledge through attending conferences, meeting with people, offering to do teaching to demonstrate their knowledge. I'm looking for that kind of intern level of commitment to learning and enthusiasm for the activities.
yeah, I completely agree with that. And I think it's not just an opportunity to share your knowledge in terms of sort of your book learning. So where people sometimes run aground is they're really focused on sort of elucidating the most, esoteric diagnosis for a particular patient, when honestly, I would much rather see you do an awesome job at basic, seizure management, migraine management, whatever it is that's being seen on the service. And so really having that solid understanding of, as Mia was saying, the synthesis, the diagnosis, the history, the physical. And then also I think the interactions with the children and families are something we're really looking for. So whatever practice or, feedback experiences you need to make sure that you are going to be really excelling in the role of the clinician, in addition to your knowledge can always come. And especially, as Mia said, if you're oriented towards, learning and asking questions and growing, but at the same time, show that you're really great at working with kids, show that you're really great at working with parents. So doing the things on general pediatrics or wherever they might be that help you with those skills. And I think the last piece that makes an away rotation challenging is it's, a different system, a different, electronic medical record, all of that. So just having really good skills for being sort of an adaptive learner and thinking on your feet and, reaching out to the residents you're working with to make sure that you're doing things, in the right way, and really asking rather than assuming what is the culture here, what is the role of, a sub-I on this team, so that you can really shine in that role.
Just remember, it's a month-long job interview. So, and we're absolutely going to ask the residents what it was like working with you.
Awesome. Thank you all. So I note that we want to be respectful of people's time. So we're at the end of today's presentation. As mentioned earlier, it might be particularly this specialty. This webinar, Child Neurology and NDD is one of the two best and great specialties to apply for advisors that are supporting other specialties that applicants are applying to, or applicants who are interested in multi-applying. These are other specialty spotlights that you can register for. I just want to give a quick shout out to the panelists once again. Thank you for taking your time, effort, building up today's webinar. Definitely appreciate a lot of your perspectives on each of the different questions today. And thank you to the audience for joining us for today's presentation as well. So with that, I'll go ahead and turn it back over to Jill so you can close us out. Thank you so much.
All right, well, thank you, everyone. We would like you to please give your feedback on today's presentation by filling out the webinar evaluation that will pop up on your screen when the webinar ends. We have recorded this session and we will email you when we post the archive. On behalf of the Association of American Medical Colleges. Thank you to our speakers and, of course, all of today's participants. Have a wonderful day.